I now call on Deputies Buckley, Kenny and Murphy regarding the underspend in mental health services in Roscommon. The deputies have 1 minute each, followed by the ministerial reply. I'll take you in order as they are in front of me. Deputy Buckley.
Conor Margaret, last Concola. I suppose we're here to discuss the report, I suppose specifically on Roscommon. And my big question here, apart from the need for specifically addressing the localised issue in this report, is to determine just how localised that they actually are. Is Roscommon an exception to the rule, especially when it comes to funding? €18 million returned from mental health funding between 2012 and 2014, Minister. We've heard a lot from the government about their strides in increasing funding in mental health from the low base that it was at for many years, but how much money is being spent on an annual basis and how much is being actually returned. 16 million in just one area is huge, and particularly when that area is not providing quality care, according to the report, or at least is failing in a number of regards, and a number of regards is being very, I suppose, PQ about it. Recently, the HSE had told me in a PQ that all money for 2017 was allocated and would be used. So, Minister, can we be sure of that until next year, given the findings here?
Thank you, Deputy.
Are other CHOs returning monies on this level on a regular basis? Is the government aware of the problem? And if so, what has been done? Or are they benefiting from announcing spending figures which don't materialise and recycling that money?
Thank you, Deputy.
Last year, the government announced a measly €15 million increase in mental health funding. Was this decided on the basis that the underspend from 16 was providing for it?
Thank you, Deputy. Deputy Ken.
Thank you, Chairman. I suppose one of the big issues in respect of this, particularly with Roscommon, is I'm very conscious that very many people in that area who are the users and the family of service users in the mental health services would have experienced huge problems in accessing the service and in the level of service that they get. And generally, the reasons that's given and the excuse that's given for all of that, Minister, as you're well aware, is we don't have the resources or we don't have the funds. And now we find that there was a huge amount of these funds being sent back. We also have had, what will I call them, scandals to some extent in some of the services in the area, and people are wondering what on earth is going on here. That the mental health service has for many, many years been attended a poor relation in the health services, and there's been that little bit of stigma attached to it, and people don't ask too many questions and don't probe too much. I think it's time to end that and time to probe into this and see exactly what is going on, because there's clearly a serious problem here with this amount of money being returned. And as my colleague has said, is it a reflection of what's happened in other areas around the country? Because if it is, there are serious questions to be answered in respect to this.
Thank you, Deputy Ken.
Thank you,
Deputy Murphy.
That are made by my two Oireachtas colleagues here this afternoon. And to say, Minister, I come here with a very heavy heart. As Deputy Kenny would know, I lost a very close friend there, and I think as the Taoiseach this morning said in leaders' questions, many people have been hit by suicide. This report, as the two previous deputies have said, is damning in every respect. €17.67 million returned, 4.57 million in 2012, 6.91 million in 2013, and 6.19 million in 2014. This report was carried out by three very eminent people from the Northern Ireland healthcare sector, namely Brendan Mullen, Dr Niall Quigley and Don Bradley. And the language, I'm sure you have read it, in it is appalling. Now, there are 27 recommendations, Minister, and I know you're a genuine man. The big worry and the big concern people have now is, are those recommendations going to be put in place? They must be. It is absolutely necessary that they are, and we'll have another minute probably to come back to say a few more words.
Mr. Daly.
Thank you, and thank you to the deputies who have raised this issue and continue to keep the focus on what is a very, very important issue and a very, I think, disturbing period for all of us to look at. The HSE is committed to ensuring that all aspects of mental health services are delivered in a consistent and timely fashion. In 2015, the Mental Health Division of the Executive determined that it was necessary to conduct an independent review of the quality, safety and governance of Roscommon mental health services to support achieving the goals set out in a vision for change and other relevant national policies. Within a short period of being commissioned, it became evident that the initial timeframe proposed to conduct a review was insufficient, and a review team requested and received extra time to complete its work. I welcome the recently published comprehensive report, which makes 27 recommendations for local service improvement. The report indicates that the review team was impressed by the majority of staff it met or interviewed and was struck by their commitment to see services improve for service users in Roscommon. The overriding concern of the majority of those interviewed, staff, service users and carers, was that patients and families in Roscommon were not receiving services in line with current best practice that would meet required quality and safety of care standards. Multidisciplinary team working, the linchpin of modern mental health services, was severely eroded in Roscommon, with fractured relationships within the area management team, within the Roscommon teams and between a number of professionals and key consultant medical staff. Throughout, there was poor line management arrangements. Leadership at a number of levels appeared to be ineffective. The majority of nursing staff interviewed believed, and the team agrees, that the senior nursing leadership critical to representing the professional views of nurses at the executive level was missing. It is the team's view that in some instances relationships appear to have broken down irreparably. Managers in any organisation have a difficult balancing role, and they should be allowed to manage without undue interference. However, this can only occur in a working environment that is conducive to mutual respect and understanding. There was clear evidence that this was absent in this instance. The review team pointed to the need for effective application of change management principles as the new entity attempts to merge disparate parts of hitherto separate organisations. The team believes that preparatory work to support the area management team should have been in place as it embarked on creating a new culture. The team concluded also that there was disproportionate focus, even at a time of straitened financial circumstances, on achieving budget savings at the cost of an adequately staffed and safe service. The report highlights that around £17.6 million of mental health funding for the years 2012 to 2014 was returned by the Galway-Roscommon area, and it details the context surrounding this. The report makes a specific recommendation on this issue to the effect that the HSE should have greater delegation of budgetary authority to promote greater accountability, better management and more effective service delivery at local level. The HSE has confirmed that funds unspent in a particular area may be reallocated elsewhere within mental health services, and this is the case here. A team has been formed by the HSE to implement the recommendations of the report. The Executive has statutory responsibility for the planning and delivery of healthcare services at local level, including mental health in Roscommon. Nonetheless, the deputies can rest assured that I and the Department of Health will closely monitor the progress of the HSE implementation team to ensure that all recommendations are delivered as quickly as possible to address at local or national level, as appropriate, all concerns raised by this important report.
Thank you, Minister. Deputy Buckley, one minute.
Thank you very much, Minister. Minister, I no doubt, look, I thank you for the answer. But in the very first paragraph says the HSE is committed to ensuring that all aspects of mental health services are delivered in a consistent and timely fashion. One of the two key points I raised was on Taoiseach yesterday was, and these are in the report, that there was more focus on achieving savings than providing safe and effective services. The second one was allegations of conspiracy. I mean, I can't say anything there that says, you know, we're delivering consistency and doing it in a timely fashion. It's been absolutely, there's been mentions of corruption here, there's been mention of secrecy, acceptance of poor standards. This report, as Deputy Murphy said and my colleague has said, this is a 43-page document, and it's absolutely pathetic in this day and age that us as public representatives have to come in here and fight to represent the people that are trying to use this service when everything inside this system is corrupt. There have been people inside in this that would not even engage in this report, and that's how low it is. And I'll tell you how bad it is. Mental health services in this country, it upsets me so much. I said, my daughter's today going to a funeral of a 15-year-old friend because this mental health service is failing.
Eugene, 1 minute.
The failure in Roscommon, and I know that Deputy Murphy mentioned it, and I'm also aware of a young woman who died whilst in the services. And at the time, you know, there was very little comeback from the service when the family and when others tried to find out what was going on and what happened. And it's really because of that that I seen this report and said, look, what's going on here? Because it flags it to the high heavens that something can happen to a young woman with a family who wanted to get a service and found that she was being rejected and pushed away, and ended up, unfortunately, with the circumstances that happened to her. And you know, and I accept, you know, you've given an answer and you say you're going to do your best and people are going to go in and do what they... But there is a cultural problem there that needs to be dealt with. And my understanding is there's people there who don't do their job, and when they're challenged about it, they go off in a hissy fit. Oh, we're being bullied and we're being pressurised and all of this. And it's a very difficult, we all know it's a difficult balance in the workplace, no matter where you are. But particularly in this type of workplace, you're dealing with very vulnerable people, and those who are charged with providing this service need to do it in a much more adequate way than what has been done to date. And I would wish you, and I know you're a new minister on the job, and I wish you, you know, all Godspeed to get this sorted out, because, by God, it needs to be sorted out in this particular area, and indeed across the country. Thank you.
I suppose every time I look at the young family of that woman, my heart aches, and they're from down the road. It's no secret. And I know that the family will be known to Deputy Kenny as well. Now, just to give the case of that woman, she had been turned away from several hospitals over a 5-week period. Her family had done everything, as Deputy Kenny would also know, to help her. There was absolute and utter failure within the system. Absolute and utter failure within the system. Now, in this report, over 60 staff were interviewed, as you would have taken up from the report. And a lot of those staff were very committed, dedicated people. And by the way, quite a number of those staff had expressed concerns to me and to other politicians over a period of time of what was going on. So what I'm saying here, Minister, and I again acknowledge your sincerity, there are 27 recommendations. I don't want to be back here in 6 months with the lads, 9 months, 12 months, talking about more tragedies and more trouble within the system. We need the extra money, and the money that was taken away from the system put back in, and we need to ensure, and I meet these people every day, as the other deputies are, who really need the services. And as things stand at the moment, the service is not there in Roscommon, and we need to rebuild it. There are great staff there in many parts of the sections, but we need to really ensure that we have a top-class service for our people.
Thank you. Minister.
Thank you again, Cathaoirleach, and again today, deputies. All I can do is provide you an assurance that I am well aware of the issue. I have spoken to a number of your colleagues that are not in this House, in the other House, and that are not in the House today. I think every Oireachtas member, to their credit, has contacted me in some shape or form or reached out to me on the particular issue of Roscommon. I am travelling down there on Monday, and I intend to meet with Tony Canavan, the Chief Medical Officer there, and I intend to get my head around what went wrong there. I can't, and I know you're not looking for responsibility for the past, but you're looking for responsibility into the future to make sure that the recommendations are adhered to, and I will accept that responsibility in full, that I have a responsibility as Minister to oversee the implementation of the recommendations. That's the very least we owe to the victims. It's not much, but it's the very, very least we owe to the victims of the wrongdoings that were there. So, as I say, I'm going down there on Monday, and I will take it as serious as I can and as I personally can to ensure that there are no repetitions of this, and obviously to keep an eye to the national picture, that issues like this aren't going under the radar in other CHOs or in other counties across the country as well.
Thank you, Minister.
Thanks very much.
When Deputy Healy